All right, guys, let's get busy talking about caffeine. So many people drink caffeine, so it's important to know about. I myself had a double espresso before giving this lecture, so I'm super excited to give it. I'm high energy, I'm focused, I'm intense, and these are all the benefits that we usually associate with caffeine. So I kind of want to start with symptoms, right? And symptoms are going to be a mixture of pros and cons. So we tend to have elevated energy, focus, concentration when drinking caffeine, which is why people love to drink it, which is why people drink it in the morning to help them wake up. However, there are some things that we don't necessarily love about caffeine. It can give us palpitations, right? It can make our heart beat really fast. Some people say that it gives them anxiety, and other people have complained about the caffeine shakes, and that's known as tremor. So these are all the ways that someone who has too much caffeine can present, or reasons why a person may want to drink caffeine in the first place. Now, let's kind of inform some of this by looking at the mechanism of action, which is actually pretty important on test day. So importantly, it has a similar structure to adenosine, and it is an adenosine receptor antagonist. This is going to lead to increased cyclic AMP, which causes a sympathetic response. Now, all these benefits and side effects make sense in the setting of a sympathetic response, right? So palpitation because sympathetic response causes tachycardia, tremors because we're at an elevated alert situation, kind of fight or flight on the tips of our toes kind of situation as well, and then anxiety because anytime we have a catecholamine surge, it can lead to heightened feelings of anxiety. Additionally, the similarities to adenosine are important for the treatment of SVT. SVT is supraventricular tachycardia. Our first-line pharmacological treatment for SVT is usually a dose of adenosine. And so if a patient has already had a lot of coffee, it is going to outcompete adenosine and make that treatment of SVT less effective. So that is going to be important when it comes to patients with SVT. They are not going to clinically benefit from adenosine treatment if they are loaded up with caffeine. And that's an important thing that might come up on test day. Now, in terms of withdrawal, I think many of us have a minor caffeine addiction. And when we don't get our caffeine in the morning, we feel irritable, we can feel tired, we can get a headache, and this is kind of some of the classic presentations of a patient who may be presenting with caffeine withdrawal. There's really not going to be a treatment for withdrawal of caffeine other than having the person drink a cup of coffee unless they want to break their habit. It's not life-threatening, it's just uncomfortable. It may last a couple of days and then it will self-resolve, so there's no treatment here.